The World Health Organization information on blindness indicates that cataract is the leading cause of blindness globally, accounting for between 40 to 50% of blindness in the world. The major causes of blindness in Ghana are cataract reactive errors, which account for 50% of sight impairment, trachoma with 15%, glaucoma 15%, and others 20%. In another first for the telecoms industry, Vodafone has teamed up with Sightsavers and the National Eyecare Unit to celebrate World Sight Day by restoring eyesight for 2,500 people across Ghana who suffer from cataract and trachoma.
In the world, it is estimated that 1% of the total population is blind. And that means that if you bring the same statistics to Ghana, 1% of our total population is blind. There are a number of challenges that we are faced with when it comes to dealing with eye health services in this country, and therefore it calls for a collective responsibility. And that's why, for example, we are excited to be working with Vodafone. What we have gone into partnership with Vodafone to do is to restore sight to about 2,500 people who are suffering from cataract and trachoma.
My name is Dr. James Adi, and I'm the regional ophthalmologist for Eastern Region. But then I'm also the head of the eye unit at the Koforidua Regional Hospital. In Eastern Region, we have about 20,000 people who are blind. 50% of the causes are actually due to cataracts. So mainly it's cataract which causes blindness, followed by glaucoma. We also have trachoma, onchocerciasis, childhood blindness, refractive errors, and then the others.
The project is being led by qualified healthcare professionals from the Ghana Health Service, who have set up over 80 screening centers across the country, offering free surgery on patients suffering from cataract and trachoma, two of the major causes of blindness in Ghana. The first step on the journey to restore eyesight was to carry out free screenings for cataract and trachoma across the country. Hundreds of thousands of people attended the consultations with qualified health professionals.
I'm Dr. Oscar Debra, head of Eyecare Unit, Ghana Health Service, and I also double as the national coordinator for the prevention of blindness. This year's World Sight Day was a unique one for us. It was unique in the sense that for the first time, we had a big corporate organization coming in to support some of our activities, and that's Vodafone. Vodafone came in big, huge to support us, and the package was that we agreed to do 2,500 cataract surgeries throughout the country. As I'm talking now, we've done over 2,010. By the end of November, we hope that we would have finished the 2,500 cataract surgeries.
Vodafone Ghana's association with this life-saving initiative reaffirms its commitment to the well-being of Ghanaians, especially those who are economically disadvantaged and have little or no access to quality health care.
It indicates crucial. Every make a brain and many dear Papa. Papa de me hospital for Susa stay many semi-cosqua. Some trade over examine to me, semi-dim Sakata, my name and son and semi-ofia. Madame for 4 diagram, mean to me in diagram will be many ninety. I am in semi-ofia, many happen for Muslim, say, many.
My name is Dr. Alfred Asafokwako. I'm an eye surgeon, and I've just been working with my team in Bremen Esikuma, where we are working now. The patient we have just seen had a developmental cataract. The cataract she developed from birth, and as she was getting older, it was getting worse, and then she couldn't see anymore. We have just performed, God willing, a successful cataract surgery, and we hope that tomorrow she will have the best of vision. We have just finished operations on 2 eyes of the patient next to me. She's Kluche, and we have just done cataract surgery for her. Before the surgery, she couldn't see anything at all, and she found it difficult to go to school. Now we have been able to complete operations in both eyes. She's able to see very well, and we hope that she'll be able to go to school in about 2 weeks' time.
Vodafone is serious about giving back in unique and meaningful ways and encourages its employees to do the same. To help the efforts for World Sight Day, hundreds of Vodafone Ghana employees across the country volunteered their time to help with the efforts to restore eyesight for patients. Staff got involved with the various centers around the country.
Doctor Fuidi, I'm by a Kurao, I'm by Kayan, the Achille by Nano Yawadan. I'm a bias, oh my menina, many Sabi and Frakura, Nanes Yamkusu, and so I am. She say, I so tick a cracker, Timmy saying, Yaminti, a bay, Timmy down was.
The major risk factor for cataract is age. All of us, once we grow old, we are likely to have cataract. We can't prevent cataract, but we can prevent cataract from making us blind. Cataract surgery is one of the most cost-effective health interventions in the world. Somebody is blind, both eyes from cataract today. Tomorrow, you can remove the cataract in a 15 to 20 minutes operation. And then the next day, the patient sees again and goes about his or her normal duty. In that sense, that person becomes productive again.
Today we are at Nima doing a free eye screening program with Vodafone. And then the most common conditions I've seen so far includes cataract, glaucoma, pterygium, and several refractive error cases.
We've seen almost 500 cases for today. We started about 1 month ago. We were doing it at Ejusu Drabin. We screened a lot of cases and we've done about 70 to 90 cataract surgeries for Ejusu Drabin.
Basically, we've seen a lot of allergic conjunctivitis and immature cataracts and a few suspicious discs. We are suspecting some people with glaucoma, a few of them. We're actually here trying to fish out those with mature cataracts so that Vodafone can help us operate on these eyes free.
My name is Dr. Daudi Mohamed Amin. For this project, we have been working in conjunction with Vodafone, and the main aim was to try and restore vision to people that were in deprived communities that could not afford the services. Basically, you're talking about cataract cases, some pterygia, and stuff of the sort. And if you look at the age group that are within the cataract, blinding conditions or vision limiting conditions, those were people that were mostly not able to get the money or the finances to pay for the surgeries. So this has been a good program that Vodafone was able to come up with, and it has helped a lot of people so much.
Many na bakuinkwa dimesha mihuni pakura mihuni paneni kise misiane kekesia na enifena yimitum di brimi ohane ananso yekrom hose yana ehwe ni bi ohanti yanko president solde ne yekoya omkohwe ya yedi ba hase be operation nti yani etisane nyina yemba na me no mo ba ya ebe ma me ne sesi die yasade ha me kakra ne miti aya na miti ya me yana de na wo so ne die
When we talk about trachoma, trachoma is basically a disease of the poor. Trachoma thrives in areas where we have dry, dirty, dusty environment. What we need to prevent ourselves from going blind from trachoma is water. Water to wash clean our faces. But apart from water, people who have trachoma will need drugs, antibiotics.
Trachoma, which is most common in the northern and upper west regions, happens when sufferers come into contact with dirty water. So to help eliminate trachoma, Vodafone is providing 10 boreholes across the towns and villages in the northern and upper west regions where trachoma is most widespread.
Now, what happens with trachoma is that there's a lot of relationship between the disease and environmental cleanliness. So there's a part of the condition that you can treat with antibiotics, and there's a part of the condition that you can handle just by taking care of the environment. So the strategy is called SAFE, and that's what we use to control trachoma. SAFE stands simply for S for surgeries, A for antibiotics, F for face washing, and E for environmental cleanliness.
Initially, Anafobisi were suffering in terms of water because our location is far away from the existing waters. So some of us, we normally travel about 1 or 2, 3, 4 miles before we can get water to drink. This compels most of us to go into the streams, drink from the streams, and mostly waterborne diseases will suffer it. Today, we are very glad that this facility is with us, and we say thank you for Vodafone.
We are so grateful. People like the Vodafone who are wanting to give helping hand, like giving logistics for us to be able to help certain group of people. My name is Kuretu Usman from Yendi. I have been blind for 4 years now. Before I was blind, I could do my housework, could go for water, could cook myself, I could milk the cows. But now, since I'm blind, I cannot do anything for myself again. I only depend on people to help me. I'll be very grateful if my eyes can see again, and I think my life will be better.
My name is Ohenemedia. I'm the ophthalmologist in charge of the Bokwai Clinic. And the patients we have just finished working on came with bilateral cataracts. And cataract is the opacity of the lens. So what we did was to remove this opaque lens and then put in an intraocular lens, an artificial lens, to enable her to see again. So the procedure is a small incision cataract extraction. It's a sutureless procedure, and it's quite brief. And with this, she'll be able to regain her sight and go about her normal activities at home.
She's thanking God for the sight she has had. She's thanking all the workers, all those who are involved in her treatment. He's saying he's happy the mother can see again. So now that she can see, they know that when she goes home, at least she too should be able to move around the house.
The funding provided by Vodafone enabled Sightsavers and the Ghana Health Service to expand screening and treatment across all regions in Ghana.
So we are grateful to Vodafone for helping us this year to make at least 2,500 people who are blind to see again. Like I said, those people are going to add to be productive, and whatever activity they are doing is going to add to the national economy.
Vodafone Ghana is serious about giving back to the people of Ghana in unique and meaningful ways, and empowering people to get the most from life.